Hi there, my name is Lisa, and this is the first time I've ever done this before. Videotaped myself and then posted it on YouTube, but there's a first for everything, so here I go. I'm doing this because I was just diagnosed with Graves' disease slash hyperthyroidism. And when I was first diagnosed, I came straight to the internet looking for any and all information that I could find about the condition and the disease. And I found it really, really helpful to look at other people's videos on YouTube who have been through this before, as well as, just find any information online that I could. So I thought it would be helpful. I have chosen to do a little bit more of a less frequently chosen treatment method, and for anyone else out there who is deciding on a treatment method and finds this video useful, that's really the purpose of it. So anyway, what is Graves' disease slash hyperthyroidism? Well, if you're watching this, you probably already know, but if you don't, it's an autoimmune condition where your immune system causes your thyroid to overact and therefore produce too much hormone. Now, before I was diagnosed with this, I really didn't know what the thyroid did. I was a little bit ignorant about that. I knew it was very important, but I didn't know exactly what it did. It does a lot. It regulates so many things in your body, and when it is overactive, in other words, when it's producing too much hormone, there's a lot going wrong. There's a lot that is way, way, way too fast. And likewise, when it's too slow, when you have what's called hypothyroidism, and there's not enough thyroid hormone, then that's not good either. Both are not good conditions to have, not a lot of fun. But I really didn't know that much about them. My sister has hypothyroidism, and she takes a pill every day. It's a very safe medication. Millions and millions of people are on it. And all it does is give you that extra boost of thyroid hormone because yours doesn't produce enough, and end of story. Super easy, super safe. So, I thought that hyperthyroidism would be similar in its treatment options, but turns out it's a little bit more tricky. So I'll get into that later. So how did this happen for me? Well, it was the middle of the night. I was sleeping and I woke up with a racing heart, very, very fast, and started to be very concerned. I had a little bit of chest pains with it as well, just like a little bit of a tightening along with the fast heartbeat. And so I was very concerned. I woke my fiance up and he helped calm me down, and it seemed to slow down a little bit, and went back to sleep. In the morning, woke up pretty early and it was racing again. So we decided to go to the emergency room, and they did a full blood panel test, tested everything came back normal, and the very last test was the thyroid, and the doctor said, your thyroid is very, very overactive. And with levels like this, it's very probable that you have something called Graves' disease, which means your immune system is causing all of this to happen. And I can't treat you, and it was a Saturday, so the doctor said, I can't treat you, but an endocrinologist specialist in this can, and he can see you on Monday. So he gave me the endocrinologist information, made an appointment for me on Monday, and I went home. In the next day and a half, over the course of the weekend, my symptoms went from 0 to 60. They just absolutely went from bad to worse than worse. And basically what I was feeling was obviously the racing heart, and that was accompanied with like a tightness, a twisting in my chest that really didn't ever go away. It would be slightly less annoying at certain times than others, but it was kind of present all weekend. So there was the rapid heartbeat, the chest pains, and the most overwhelming thing was tiredness. I felt insanely tired. And I'm someone who's normally pretty active. I run 4 to 5 times a week on a good week, but I work out a lot. I'm really active. So for me to be so tired, it felt very, very strange. For instance, walking 5 steps to go get a glass of water from the kitchen was the hardest thing I'd ever done. It was really, really unbearable how fatigued I was. I felt like I was 100 years old. I could just move so slowly, and I could only talk so quickly and out of breath. I was horribly out of breath. I'm a little bit out of breath now, but it's much better. I felt like a dog panting. I was just, that's what I was like all weekend. I could not, my mouth was hanging open. I could not get enough oxygen, it felt like. And just out of breath. Talking was, very very winding, and moving was very winding. I was just winded in general by doing the least of things. So, so that was very odd and very strange. Also, you have elevated levels of anxiety, which is not good because you're having all these weird symptoms, most weird and alarming being the heart, and then you're anxious on top of it, so then you're more anxious because the heart is being weird, and it all kind of snowballs, and the anxiety just increases. So anxiety is one thing I was experiencing a lot that weekend, a little bit of irritability as well, and you know, just kind of really, I could not wait till Monday to see that endocrinologist and to find out what was going on. Because my sister's hypothyroid and she takes 1 pill a day and she feels totally normal, I thought, I'm going to go there on Monday, I'm going to get a prescription, I'm going to start feeling better by midweek. This will all be behind me. And I could not wait to get to see that endocrinologist. Well, so Monday came and I saw the doctor, and turns out it's not as simple as just taking a pill for the rest of your life. The prescription so basically the treatment options that he told me were, one, you can take medication, but in the case of hyperthyroidism, the medication is a little bit more risky. It was his opinion that the medicine is not totally entirely safe, and so therefore he does not prescribe it. Now, I'm not saying the medication is unsafe. That was just this one doctor's opinion. I saw another endocrinologist that did not think the medication was particularly unsafe. So I think it's a doctor to doctor kind of a thing. Everyone has their own opinion about it. This doctor that I saw said the medication, to be honest with you, is not that safe. It can cause liver failure in some rare cases, and your blood is just not normal when you're on the medication. Your white blood cell count can be affected, so we have to monitor you very, very closely when you're on the medication to make sure that your body isn't doing something bad, and just make sure that you're healthy. And the worst part about this option is that you can only take the drug for 6 months to a year because of its, you know, kind of controversial nature. They don't want you to be on it for that long because it's just not safe. And once you're off of it, there's a 60 to 80% chance that your hyperthyroidism will just come back out of the blue in a week, in a month, in a year, in 5 years. You don't really know when, but it's a very high chance that it will come back. One endocrinologist I saw said 60% chance, another one said 80% chance. So either way, not great odds that it's going to be gone forever. So that didn't sound like a great option to me, so I wanted to know what the next option was. And the next option was one that he normally recommends, this first endocrinologist. He said, I normally recommend this, and it's a form of radiation, which of course initially was a little bit scary to hear. A week ago I was fine, and now I'm talking about getting radiation treatment. So that was a little bit alarming, not to mention the anxiety, you know, turning the wheels in my brain. And so he said it's a pill, one pill that you take. It's called radioactive iodine, and it goes straight to your thyroid and it destroys your thyroid. And to the point where you actually become hypothyroid. So you're hyper, you have too much thyroid hormone, then you go past normal all the way down to having too little thyroid hormone, or hypothyroid, and then they give you a prescription for that very safe, very commonly taken drug that everyone who's hypothyroid takes. And that gets you back to normal for the rest of your life. But you will most likely become hypothyroid for the rest of your life. So, you know, not great because it you know, gives you a different condition, but a better condition, so that's not so bad. The main thing that freaked me out about it was that it's radiation, and obviously that's, you know, controversial and potentially harmful to your body. Some research I've done and some doctors that I talked to, actually only one doctor that I talked to, said it has no long-term side effects, nothing can happen from this stuff, it's super safe, nothing to worry about. Another doctor I talked to, as well as some research online, says something quite different, that there are side effects, that, you know, there are long-term, later in life things that can happen to you from this treatment, as anyone would probably assume. But again, it seems fairly safe and fairly commonly done. Actually, 90% of endocrinologists in the US recommend the radioactive iodine treatment. So it's very commonly done. In Europe and Japan, it's a different story. The majority of endocrinologists there recommend doing the drugs instead of the radioactive iodine. So again, that was a little bit unnerving because I wanted all the endocrinologists to all say the same thing and tell me what was the best thing to do. But because there's some controversy over it, it's kind of a hard option to choose. But to be honest, I was leaning towards the radioactive iodine as opposed to the medication. Many people do completely the opposite, but for me, I felt it's the most surefire way to get rid of it. The side effects seem not that bad, according to most people, so that's what I was leaning towards. And then, of course, there is a third option, and that is to remove your thyroid entirely. And obviously that fixes the problem because you have no more thyroid to produce hormone at all. And therefore, you have to take a drug for the rest of your life to have any thyroid hormone in your body, which is necessary to function. So, so you take a drug for the rest of your life, you remove your thyroid. Again, very, very extreme. So all three options didn't sound awesome to me. They all were pretty extreme. So I went home and I started thinking about my options, and I started doing some research online. Now, also, to backtrack, I was officially diagnosed with the Graves' disease, so that was something else I knew. So I started doing some research, and without even really Googling, hyperthyroidism alternative treatments, not Googling anything like that, just Googling hyperthyroidism treatments. Very quickly, you find that there are a lot of people out there that say that you can treat it naturally, which of course, initially, you can't help but be a little skeptical about it. It's obviously an extreme condition. Just diagnosed with it and seeing a doctor, a specialist, he tells me, there are these three extreme treatment options. So for someone else to say you can treat it naturally, initially I was a little skeptical. I started doing more research. One website I found very helpful was naturalendocrinesolutions.com. And that is actually the website of a doctor who was diagnosed with Graves' disease, and he treated it completely naturally. And so it is his informational space about natural treatments for thyroid conditions. So I started to think more about it, did a little bit more research on it, and I have a naturopathic doctor that I saw for my celiac disease, because I actually have something called celiac disease, which is a totally different autoimmune condition. And I'm sure you've heard of it, it's when your immune system attacks your digestive tract anytime that you eat gluten. So you cannot eat gluten for the rest of your life. And it's completely autoimmune. It's not a stomach issue, it is an autoimmune issue. And now being diagnosed with Graves' disease, that is also an autoimmune issue. So for instance, the celiac disease is not my stomach having an issue, it's my immune system having an issue. And likewise, the Graves' disease, it's not my thyroid having an issue, my thyroid's just doing what the immune system is triggering it to do. So the thyroid is not the issue. And one thing that the doctor who has the website naturalendocrinesolutions.com, one thing that he talks about is that if you have an autoimmune version of a thyroid disorder, then it's really not the thyroid that's at fault. And what Western doctors do is they try and treat the symptoms. So they just fix the thyroid, get the thyroid to stop overproducing hormone. But really, if it's the immune system that's at fault, then you're going to fix the thyroid and make everything seemingly normal in your body, but you're still going to have a super weak immune system. And plus the fact that I already have one autoimmune disorder, developed another one here, made me think, well, I probably should get my immune system in check, because I'm potentially going to develop a worse autoimmune disorder later in life. I already have two that are fairly treatable, so I really don't want to get a third one. So to me, it just made more sense, because the Western treatments just treat the symptoms and they kind of ignore that underlying autoimmune issue that's going on. And the natural treatments really get to the root of the problem. So if you've never worked with a naturopathic doctor before, naturopathic doctor, or ND, as opposed to a medical doctor or MD, the naturopathic doctor is really going to look at the root of the problem. Any issue that they treat, they look at the root, and they treat it with diet, supplements, natural forms of treatment. A lot of times they will refer you out to a medical doctor if your condition is something that needs a much more extreme or aggressive type of treatment. So it's not to say that NDs don't believe in Western medicine, but they think that it should be used only in certain extreme conditions. Now, a medical doctor is not going to look at the root cause, they're going to look at the symptom and they're going to fix the symptom, and they're very good at continually having a track record of fixing the symptom, and that's absolutely what medical doctors do, and I think there's a place for both. But in this instance, it seemed to me that there could be some merit to trying the natural method before resorting to something as extreme as the Western methods are. I talked to my naturopathic doctor that I had seen when I was developing celiac disease, and I actually talked to a whole different naturopathic doctor. Both of them said we've had many patients with Graves' disease, many patients with hyperthyroidism and hypothyroidism, and all of them we have treated completely naturally, and they all got better, and they all restored their health with fully just natural methods. So, I got a little less skeptical, and I started to think maybe there's something to this, and mainly because of this issue I was having with the Western treatment not addressing the immune system and not really fixing that root problem of what's going on. So I went to actually had an appointment with my naturopathic doctor, and she started me on some supplements. And I'm happy to report that it's been about 3.5, almost 4 weeks since I saw her and got started on this treatment, and I feel leagues and leagues better. I told the endocrinologists I saw that I was doing this. I saw 2 endocrinologists and 2 naturopathic doctors, so kind of a wide array of experts on this. And the endocrinologists both said, you're going to get worse, you're going to feel awful, you're going to harm yourself if you do this. They were very much not in favor of this. And anyone watching this now who's a medical doctor or who believes in the Western protocol for this is not going to agree with my choice here. But I chose to try it anyway. And the natural treatments have made me feel so much better. So I feel as if I'm moving in the right direction. The natural treatment takes a lot longer. It's normally going to be months and months before you're back to normal, whereas with the Western treatments, especially with the medication route, it's a lot faster that you're feeling normal and that your thyroid levels are back to normal. I'll continue to check my thyroid levels over the next couple months, and it will take a while on the natural route for them to go back to normal. Now, I'm not saying I'm 100% sure that this is going to work. I'm very confident that it is, but I may be in a couple months choosing to do a Western option because maybe this didn't work so well. But I do feel that I have to give it the full college try if I'm going to resort to one of the more extreme options. So for me, it's something that I have to do just for my personality and really getting to the root of what's going on. So I feel good about it. So if you are someone who thinks you may want to try this, I wouldn't recommend doing any of this on your own. That's why I'm not saying what supplements I'm taking and showing you the dosage and showing you all that stuff. Just know that it's a slew of supplements, a whole lot of stuff that I'm taking, and I've been changing my diet slightly as well. But it's nothing you should tackle on your own. If you are interested, I would say to go to naturalendocrinesolutions.com and see what they have to say, and find a good naturopathic doctor, and they can prescribe you the right amount of supplements to take. Again, this is not for everyone. I absolutely don't think that there's anything wrong with choosing one of the Western treatments. For me, it's something that I have to try this first before I resort to something like that. And hopefully, in a couple months, I'll be reporting that I am better and that my thyroid levels are back to normal. We'll see, but this will be a good documentation of that process. Another thing that's important to note that none of the medical doctors talked to me about was state of mind. All the medical Western doctors said, this is something that happened to you, we got to fix it, and then you'll be back to normal. They didn't say anything about my personality or my lifestyle that may have caused this, whereas the naturopathic treatment is very much about that. So for me, I am someone who stresses a lot. I carry a lot of stress normally, daily, and I also am not the best at managing my stress. I own my own business and I work from home, and I am a perfectionist and I will not quit. I'll kill myself until something is exactly the way I want it to be. So that's good in some ways and very bad in other ways. So for me, when I went to see the naturopathic doctor, they said hyperthyroidism and Graves' disease normally develops because you are stressed. Now, it's not to say that if you are a stressed person, you will get Graves' disease. You have to have the genetic component there to develop it. But if you have the genetic component and you are under an abnormal amount of stress, and if you are pushing yourself too hard, it's very likely that you will develop something like this. And so that's a huge component to it. For me, part of my treatment has not just been the supplements and the diet, but it's also been a lifestyle change of really chilling out, calming down, not working as much, doing more for me. One of the things that the naturopathic doctor said is that if you have Graves' disease, sometimes it's a result of not having enough me time, not having enough time of just doing what you want to do, giving yourself that freedom, and that can sometimes lead to it. So I know that my lifestyle has played part of a role in this, and I am willing to change it to make myself healthier. And in general, it's just a really, really good wake-up call to take healthier steps, make healthier choices in my life on a daily basis. So I'm very excited and very eager to see how this moves forward. Again, I'm feeling leagues better. All of my symptoms are markedly different. I mean, I could not be making this video several weeks ago. I would have been, passed out after saying 2 sentences because I was so tired. So I'm still tired, but less tired. I still have a high heart rate, but it's better. It's normally like in the 90s. Every once in a while it goes a bit over 100, but it's been consistently in the 90s, so consistently lower. I'm eating less. I don't have as crazy of an appetite. I think I forgot to mention that symptom. You're super hungry and you can't stop eating and you lose weight. But recently, my appetite isn't as bad. I think I've gained a couple pounds in the past week, so that's really, really good. So, all the symptoms are better. So I'm positive about it. I hope that I have good news to report next time I do a video. Please stay tuned if you're interested to see what happens. And again, if you want to look into natural treatments, please do, but please consult with a certified naturopathic doctor if you are going to do so. Okay, thanks so much. See you guys next time. Bye.